my name is Eiran Gorodeski. I'm a heart failure cardiologist at University Hospitals in Cleveland, Ohio, where I also serve as the director of the Advanced Heart Failure and Cardiac Transplantation Center. I'm a professor of medicine at Case Western Reserve University. Thank you so much for your interest in our non-accredited Heart Failure Fellowship, also known as the Heart Failure Internist Fellowship. I'm going to be spending the next few minutes sharing important information about our program that you may find of value. So I'd like to start off with this impressive photograph of the front of our hospital complex. This is UH Cleveland Medical Center, where you would be spending the bulk of your year of training. So first of all, let's define what a heart failure internist is. We believe that a heart failure internist is an internal medicine residency graduate, like you, who goes on to complete additional comprehensive heart failure training under mentorship of an experienced advanced heart failure subspecialty group of cardiologists and their multidisciplinary team. A heart failure internist attains advanced level knowledge and skills to provide competent heart failure services, and a heart failure internist is able to assess, treat, and manage patients with heart failure by ideally utilizing a multidisciplinary team approach in a patient-centered manner. This is the stuff at the very highest level that we're going to be working on with you during your year of training with us. Specifically, here's what we're offering: a non-accredited, quote-unquote, pre-cardiology fellowship that's focused on all aspects of stage C and D heart failure. It involves rotating at a major academic medical center, caring for patients on the floor, ICU, and the consult service who have heart failure, performing hemodynamic studies in the catheterization laboratory along with our team, having the opportunity to participate in ambulatory specialty clinics, having the opportunity to attend daily general cardiology didactics and lectures, some of which are specific, of course, to heart failure. If you're interested, you'll be able to pursue various research projects and opportunities. You will receive a salary and benefits, and will also have the opportunity to pursue moonlighting opportunities if you're interested. Obviously, you're asking yourself, how will this fellowship help me? So we think that it will help you in a few ways. First, importantly, you will walk away having learned how to diagnose and manage patients with advanced heart failure. I'll talk more about this in a moment, but you'll be eligible to sit for certification via the HFSA, something called HF Cert. This is new as of 2024. Our team will work hard to help you get the job or fellowship that you want. We believe that if you're going down the road of further cardiology training, your candidacy for general cardiology fellowship will be improved via mentorship that we will provide, intensive review of your CV and essay to help you prepare for the application process. We'll provide you interview preparation and coaching. My colleagues and I are well networked throughout training programs in the United States, and that may be of use for you, and we will advocate on your behalf. So new as of 2024, the Heart Failure Society of America has announced that they will be expanding eligibility for graduates of a non-accredited heart failure fellowship training program like ours. Let me read from their website what they say. So the HF Cert has been developed to recognize providers who've demonstrated advanced level knowledge and skill to provide competent heart failure services in the United States. The HF Cert exam is offered 4 times during the year. The HFSA writes on their website, by passing the HF Cert examination, heart failure providers not only display their aptitude in each specialized knowledge area, but also present their expertise in heart failure with an HF Cert credential. So you'll be able to walk away from our fellowship with this important credential that's offered by a recognized national society. This is a bird's eye view of where you will work and live for a year. In the square is Cleveland Medical Center. As you can see, it is nestled in Case Western Reserve University that extends in an L-shaped manner from over here to over here. So these are the undergraduate and graduate science squads. And then Case extends further. Here is one of the libraries for the university. And over here is the Case Western Reserve University School of Business in this neat looking structure with a metal roof. The Cleveland Orchestra performs over here. This is called Severance Hall. Cleveland Orchestra is one of the top orchestras in the United States. And behind it is the incredible Cleveland Museum of Art that's open to the public. And you should definitely go visit it in your year with us. As far as the campus itself, the campus contains multiple hospitals. Rainbow is a large pediatric hospital. Lakeside Hospital has many patient rooms and some of our offices. The Lerner Tower in the back has many of the cardiac ICUs and step-down floors. The Seidman Cancer Center is the newest addition to the campus. And then there are several research buildings that belong both to Case Western Reserve University and university hospitals in this quad. Here's a shot of a very busy lobby at the Seidman Cancer Center. So some background about university hospitals. UH is an integrated not-for-profit academic health system. It has 4 hospitals that I already showed you at the Cleveland Medical Center and an additional 14 community hospitals. It employs 1,200 residents and fellows in 113 training programs. It is the largest primary care network in Northeast Ohio and one of the largest accountable care organizations in the United States, with nearly 600,000 lives served. It is a major affiliate of Case Western Reserve University School of Medicine. It's a vibrant and growing health system with over $4 billion per year in revenue. It has approximately 4,400 physicians and an additional 1,100 independent physicians. It's also the official healthcare partner of the Cleveland Browns. Cleveland Medical Center specifically was founded in 1866. It's a 35-acre campus. It has over 1,000 staffed beds. And as already mentioned, it includes UH Lerner Tower and Lakeside, which are the medical hospitals, the UH Seidman Cancer Center, which is a freestanding cancer hospital, UH McDonald Women's Hospital, as well as a pediatric hospital called Rainbow. University Hospital's Cleveland Medical Center is nationally recognized in multiple fields, including cancer, cardiology, heart and vascular surgery, gastroenterology and GI surgery, geriatrics, pulmonology and lung surgery, and urology. We have an institute called the Harrington Heart and Vascular Institute, which is the umbrella organization for the various cardiac service lines. This comprehensive cardiovascular institute is an umbrella organization for cardiology, cardiac surgery, and vascular surgery. Our mission is to provide clinical care, education, and research. We have multiple fellowship programs. We are affiliated with the Case Cardiovascular Research Institute, as well as the Harrington Research and Innovation Center. Here's an overview of the Institute. The Institute brings together multiple centers, including, for example, the Heart Surgery Center, Vascular Center, EP Center, Cardiovascular Imaging Center, of course, the Advanced Heart Failure and Transplant Center, amongst others. This is a map of Northeast Ohio, and it shows you all the various clinical service sites for university hospitals. The reason I am sharing this slide with you is to demonstrate the huge geographic outreach of our healthcare system that stretches all the way from the Pennsylvania border to Sandusky, Ohio, and then down into Akron. So just to give you a sense, to drive all the way from here to here takes probably about 2 hours. And then to drive from Cleveland all the way to our southernmost tip is an extra hour of driving. So this is a very large geographic area, and patients with heart failure and complications of heart failure are referred up to Cleveland Medical Center. And this demonstrates that during your year with us, you will be exposed to a very large volume of sick patients who are ultimately cared for in our medical center, especially those who need to be evaluated for advanced heart failure therapies. Our Harrington Heart and Vascular Institute leadership is shown here. The president of the institute is an interventional cardiologist, Dr. Mehdi Shishabor. The chair of cardiology is Dr. Sanjay Rajagopalan. I serve as the center director and section head for heart failure and also the fellowship program director. Supporting you in our fellowship will also be Dr. Michael Zacharias and Dr. Robert Montgomery, who are our fellowship associate program directors, as well as Dr. Monique Robinson, who is our fellowship core faculty, and also the director of the Heart Failure Academic Grand Rounds. Here are the staff that you will be learning from, and I marked in red letters those who are specifically involved in our training programs. There's Dr. Montgomery, Dr. Zacharias, and Dr. Robinson. On the right are also our surgeons, who are heart failure surgeons who specialize in LVAD implantation and cardiac transplantation. We have multiple heart failure services at university hospitals. This includes ambulatory heart failure clinics, including chronic heart failure management, identification and workup of stage D heart failure, as well as various cardiomyopathy clinics for amyloidosis, sarcoidosis, and hypertrophic cardiomyopathy. Skipping to the main hub where you will be a fellow, we have multiple heart failure inpatient services, including our own primary floor service that primarily cares for patients who underwent cardiac transplantation or LVAD. We have a heart failure consultation service that provides consultative services throughout the hospital to multiple teams. And we have our own 10-bed heart failure ICU that's dedicated entirely to patients with advanced heart failure and those who have medical complications after cardiac transplantation or LVAD. So a few words about the contents of the fellowship itself. Our fellowship's missions are as follows. First of all, to introduce you to cardiovascular medicine with a specific focus on advanced heart failure and cardiac transplantation, to engage you in academic scholarly activity, which will hopefully open the door for you to become an academic leader, and of course to help you match into general cardiology fellowship if that's what you desire, or to find the job that you desire via intensive preparation, mentoring, networking, and advocacy on your behalf. I'd like to give you a sense of the rotations that you're going to be doing during your fellowship year. A very popular rotation, which is 7 days long block, is the Heart Failure Intensive Care Unit. As I already mentioned, we have a dedicated 10-bed heart failure ICU. We often use swans to help manage heart failure in these patients. We have a heart failure consultative service and floor service that you will rotate on 1 week at a time. You will have an opportunity to rotate through the catheterization laboratory and specifically learn how to do right heart catheterizations. And then you'll have a chance to engage in multiple electives, including ambulatory specialty clinics, inpatient palliative medicine consults, general cardiology consults, EP consults. You'll have time to spend in the echo lab to develop expertise in reading echocardiograms. And if you'd like to pursue research, you can choose to have dedicated time for that as well. We have a tremendous amount of education that you can partake from. The crown jewel of our educational series is the Heart Failure Grand Rounds lecture series that happens Wednesdays at noon. Dr. Robinson and I often tweet about it, so you can check out our Twitter accounts to see some of our prior speakers, many of which are national and internationally recognized speakers. We have a Heart Failure LVAD Transplant Journal Club, as well as a patient care conference that you'll be able to participate in. Additionally, outside of our section, there is a clinical case conference, an M&M, that happens every Wednesday morning, cardiovascular medicine grand rounds every Thursday at noon, and an echo conference that you can participate in every Monday. If you're interested in research, there are a wide variety of opportunities to pursue clinical research. This includes utilizing existing institutional databases, performing small prospective studies, performing quality improvement studies, using national databases like INTERMAX or the UNOS STAR file, which is the comprehensive solid organ transplant file. Our institute has multiple ongoing pharmaceutical and device trials. Very motivated fellows have been able to publish 1 or 2 abstracts in the past. 2 years ago, we had somebody who presented at the American College of Cardiology, which is an important national forum. So if you are focused and would like to succeed in research, we have plenty of opportunities for that. We understand that you are using this year not only how to learn to be a better physician, but also figure out how to match into cardiology fellowship or to find a job. Your success is our success. And the following things are available to you and that have been leveraged by prior fellows. We provide very intensive career coaching to help you succeed. We're very proactive about networking, connecting you with the people that may help you with what you'd like to achieve. We advocate on your behalf, and we help prepare you for job interviews. Here are some of our fellows, class of 2021. Some of our fellows from class of 2022, along with Dr. Zacharias and myself standing on the sides. Here's a fellowship class in 2023. There's Rob Montgomery, myself, and Dr. Zacharias, and all of our fellows. We also think that you will enjoy living in Cleveland for a year. Cleveland is a cultural destination. University Circle, which is the geographic area where we are, along with the university, was named Best Art District in the United States in 2021. If you're interested in shows, Playhouse Square in downtown Cleveland is the second largest performing arts center in the United States. Cleveland has a lot of nature via the Cleveland Metro Parks, the Cuyahoga Valley National Park, and Lake Erie. And if you like to party, you can go to downtown Cleveland. We have the Warehouse District, where there's fine dining, theater, and professional sports. I hope that this was useful for you as you consider whether you're interested in joining us as a fellow in our Heart Failure Internist Fellowship program. And we hope to see you in Cleveland. Thank you so much.